Ketamine, also known as Special K, Kit Kat, Vitamin K on the streets, an illegal club drug taken for its psychedelic effects. Now, legally treating the psyche.
Enjoy your journey. We'll be here if you need us.
Hi, Corey. Hi, how are you?
Corey Mendoza is a patient at Shaw Minds Healing Center in Sacramento. She's here for ketamine-assisted therapy.
I was in an abusive marriage for 9 years. The abuse continued on for 15 more years.
To treat complex PTSD.
One session sometimes could feel like 200 hours of counseling. Like, it literally, like, wipes away trauma.
This is her 11th ketamine journey at Shaw Minds.
Where are we at? What is coming up for you as you think about this session today?
Each session starts with an hour of talk therapy.
Take a big breath in through the nose.
Intention setting.
Open mouth, exhale.
The medicine administered through an IV by a medical professional. Then Corey waits for the ketamine to kick in with the help of a guide.
Know that you're in a safe place to let go.
Shaw Minds is one of the first ketamine clinics in Sacramento. Co-founder Dr. Aliyah Ahmad says the response has been overwhelming.
We are seeing an epidemic of what's happening in mental health currently. The lack of efficacy, the lack of seeing people benefit from conventional ways of treatment.
As ketamine clinics pop up in cities across Northern California, Dr. Smita Das, Associate Professor of Psychology at Stanford University School of Medicine, says they should be approached with caution.
Common side effects are nausea, drowsiness, dissociation. Rarely, though, some people can experience a bad trip. They may also have paranoia, and also, in some cases, may have suicidal ideation.
A new Institute of Psychedelics and Neurotherapeutics at UC Davis aims to study the effects of these drugs on the brain.
Psychedelics specifically refer to these powerful compounds like LSD, psilocybin, which from magic mushrooms, DMT from ayahuasca,
and their potential to treat mental illnesses, including anxiety and depression.
The Institute is founded with the idea of using psychedelics, but we are expanding that idea to other compounds, and this would include drugs like MDMA, also known as ecstasy or Molly, and ketamine.
Associate Director Dr. John Gray believes the research is promising.
The level of response in the people that took these compounds in those trials were larger than what we had seen in many other trials of traditional antidepressants.
Dr. Das warns it isn't accessible or sustainable for everyone.
So they may be pouring a lot of money into unproven treatments, not getting positive results, and at the end, they're in a worse off situation than when they started.
For patients like Corey,
Everything's very visual, lots of vivid colors. It's a lot of sensations.
she believes her ketamine journey is bringing her one step closer to healing family trauma.
It's hard to see that there is a light at the end of the tunnel, and that's like how I feel. It's like fixed.
A ketamine-assisted therapy session can cost anywhere from $400 to $800 per session, so it's not cheap. It's not covered by insurance at this time, and patients have to keep going back for maintenance treatments. The research isn't clear on whether this is a long-term solution for treatment-resistant depression. And as far as who's eligible for this treatment, for now, it's up to each doctor's discretion.
Wow, really eye-opening stuff, though. But yeah, the long-term effects, I guess that's why we have to kind of wait and see what happens.
And that's what they're doing at the UC Davis Institute, is to see how this is going to affect people long term.
All right.